Coming to the stage today, we have Paula Brandt, Terry Auger, and Elin McLoone. Paula, our first presenter today, is the Expanse Minnesota co-founder and chair of the Minnesota Overdose Awareness. She has developed and worked in programs that serve people with mental illness and/or substance use issues for over 40 years. She has dedicated her career to advocating for person-centered, common-sense, compassionate care. Presently, she is co-founder of Expanse Minnesota and instructor with the Psychedelic Somatic Institute. She is also serving as board chair of Minnesota Overdose Awareness, which is a nonprofit leading the overdose awareness and prevention. She is on the Psychedelic Task Force, and she loves to dance, rock and roll. Please give a warm, big psych welcome to Paula Brandt. And also coming to the stage with Paula is Ian McLoone, who is a speaker that will be talking to you guys about addiction therapists. He is an addiction therapist, co-founder of Expanse Minnesota, and a member of the community faculty in the University of Minnesota's Integrated Behavioral Health Counseling Program. A little known fact about him is that he met Keanu Reeves when he was a kid. I love that. Please also give a warm welcome to Ian. Coming also to the stage is Terry Auger. Our next presenter is a worker for Hennepin County Human Services in Public Health, serving adults with mental health and substance use disorders. He is a board member of the Professional Association of Social Workers in HIV/AIDS and Minnesota Overdose Awareness. He is a consumer advocate for holistic approaches to well-being, health justice, and equity. He is the presenter, has lived his experience with substance use and occurring disorders. Please show some love and welcome to the stage Terry Auger as well.
Good morning, everybody. Thanks for coming. Thank you to Big Psych for having us and hosting this fantastic event. What a sea change we're experiencing here in Minneapolis and certainly in other parts of the country and globally, and we're just thrilled to be a part of it. So I just wanted to briefly talk a little bit about the organizations that we're representing. Ian and I founded Expanse Minnesota. We're a clinic up in Spring Lake Park just a little over a year and a half ago. And really, the primary motivation for opening the clinic was to have a space where people that need mental health treatment, help with their substance use issues, have access to high quality, compassionate, person-centered, science-informed, progressive care. We've got a couple really amazing progressive psychiatrists, one of who's in our audience here today, an amazing team of clinicians, many of them are duly licensed. We have a lot of competence in treating trauma, and we're also specializing in psychedelic somatic interactional psychotherapy, which is a form of psychotherapy that really brings body and deep attunement with the therapist and psycholytic use of medications to help people resolve some of the trauma that kind of sits in their autonomic nervous system. And it's been just an amazing process. I'm also representing the Minnesota Overdose Awareness organization. We're we're a brand new nonprofit working under Propel as our fiscal sponsor. Minnesota Overdose Awareness has really been kind of the project of a man named Miles Hamlin, who isn't able to be here today. But I met Miles about a dozen years ago and have been working with him every year to do annual vigils, recognizing people that have been lost by overdose. And Miles and his crew have been, helping the community get access to Narcan long before any of us even knew what it was. And Terry has graciously also joined us in that initiative. And we'll be talking more about some of the things that the Minnesota Overdose Awareness Group is working toward.
Cool. Thanks, Paula. Thanks, everybody. Thanks, Big Psych. Thanks, Jade, and Big Psych for putting this together. And anytime I get a whole day to hang out with a bunch of fellow psychonauts is a good day. So thanks. We're here to talk something about a little bit serious. It's an exciting time right now in the fields of drug policy, harm reduction, also known as health and happiness policy. And there's probably more cool stuff happening today than at any other time in our lifetimes, right? Between the decrim movements, legalization, the safe consumption sites, the safe supply, right? There's more happening today than maybe ever before. However, right, these gains are incremental and tenuous, it turns out. Sounds like there might even be pressure on the only existing safe consumption sites in the US legally that they might move to shut them down. So, despite all this cool stuff happening, we have a long way to go. And we're here to talk about a common sense solution that we need to advocate for here in Minnesota. This is the backdrop to our talk today. We are now losing what would previously be a fundamentally unfathomable number of humans every year to overdose. We crossed the 100,000 deaths threshold, and that is chilling. And it's urgent. This is an emergency, okay? We need common sense solutions, and we need them now. And that's why we're here today. And unfortunately, Minnesota is not immune, right? Sometime in the last 4 years, we saw a sudden and terrifying uptick in overdose deaths, going from 229 a little over 10 years ago, 5x within the last couple of years. So we're here because it's urgent and because we need bold solutions.
So this slide's from the Minnesota Department of Health's drug use dashboard, and there's lots of really good data there to look at that's descriptive. But for the purposes of our discussion today, I want to highlight a few data points that tell a story here in Minnesota. Of all the drugs, including alcohol, opioids and psychostimulants account for the bulk of hospital-related admissions. Opioid-related admissions have doubled in the past decade to 10,000. The street drug fentanyl is steeped in all our drug supply. Most of us know somebody that's died of a fentanyl overdose. U.S. deaths due to fentanyl have quadrupled in the past 5 years. Native Minnesotans were 10 times as likely to die of a drug overdose than white Minnesotans, and black Minnesotans were 3 times as likely to die as white Minnesotans. This begins to tell a story of health inequity with the opioid crisis, underscoring the historical trauma experienced by Black, Indigenous, and people of color. The hospital data shows the shift in prevalence moving into Black and African communities. Local media has highlighted this in a documentary called The Forgotten Ones. It's about the impact of the opioid crisis in African communities. It's also what I observed in my work with the county. So when we talk about drug use and the opioid response, we also have to talk about infectious diseases. About a decade ago, I got infected with Hep C from injection drug use, and I also been a carrier of HIV since 1995. So this story is personal to me. We have to reach drug users where they're at, and not only prevent overdose and death from opioids, but also to keep drug users safe from these serious infections while they're using drugs. So about 1 in 10 Minnesotans are diagnosed with HIV from drug use, and about 2/3 of new infections here in Minnesota are people of color. Now that's a pretty glaring disparity considering that 83% of the state is white. The health department continues to monitor 2 ongoing outbreaks. There's a Ramsey County and Hennepin County cluster, and then one up north in Duluth. These are associated with injection drug use and the opioid crisis. New Hep C viral infections are 4 times as high as they were a decade ago. 2/3 of the people that get infected with Hep C is from injection drug use. And Native communities are mostly impacted. And this sadly adds to the narrative of BIPOC communities being disproportionately affected. So for over 25 years, the data has shown that safe supplies and access to sterile drug use equipment reduces infection. This also includes stuff that one can smoke with. So those are viral infections, but we also have to talk about bacterial and microbial infections associated with drug use. And endocarditis is an infection that attacks the heart, and it's common among injection drug users. It can destroy heart valves and may require surgery and antimicrobial therapy. It's a serious condition. I've had friends that have had open heart surgery because of this. Rising rates of hospitalization for this infection have been tied to injection drug use and the opioid epidemic. So wounds, skin, and soft tissue infections, sometimes called SSTIs, they're a major health concern for injection drug users, and they're cited as the most common reasons why injection drug users show up to the ER. These often include like abscesses that need to be drained in a clinical or hospital type setting, wounds that need to be cleaned and bandaged, and antibiotics are often used for treatment. So these acute and chronic infections often mimic opioid withdrawal. So that would be like fever, chills, and malaise. And it's important to have community-based health networks or peer support to rule out these potential infections and get people linked to testing and treatment. So as a strategy, supervised consumption sites aim to reduce these infections and provide linkages to these valuable health resources. So Dr. Nora Velko, the director of the National Institute of Drug Abuse, she's got a long CV, and I think it's important for leadership to say things that direct and move drug policy in the right direction. And she frames this whole inequity thing rightly. She says, systemic racism fuels the opioid crisis just as it contributes mightily to other areas of health disparities and inequity, especially for Black people. We must ensure that evidence-based interventions tailored to communities are able to cut through the economic and social factors that drive disparities in substance use and addiction to reach all people in need of services. We also have to look at stigma associated with drug use and infectious diseases and to mitigate those complicating factors.
Thanks, Terry. So a couple exciting interventions that are gaining steam. As I mentioned before, Safe Supply is a response to the toxic poisoning of the drug supply vis-a-vis fentanyl. In Vancouver, British Columbia, and other parts of Canada, it started out as a pilot where prescribers were prescribing FDA or at least medications of known purity and quantity, and that got ramped up thanks to COVID. And turns out the response was phenomenal. And it includes essentially prescribing opioids, stimulants, and benzos to people who are otherwise using the illicit forms. And it can serve as a way to connect people to much needed services. Slide, please. Oh, there we go. Okay. Turns out the participants in this program fucking love it, right? It's great. People get the drugs that they need. They get it of known quantity and known purity, and it saves lives. It saved my life. My life is so much better. It's been hard, but now I know happiness. And again, this doesn't seem radical to me. This seems like a common sense approach. Come on, baby. This way? Nice. Okay. Another intervention that gained steam thanks to the pandemic was the supervised consumption sites. Gained steam here in the US, right? Because across Europe and Canada, this has been around for decades now. Say supervised consumption sites where people can bring their own drugs, use them in a medically supervised setting, save lives. People don't die. If they have an overdose event, they get revived on site. And they are scientifically supported in terms of preventing overdose, increasing health, and offering linkage to services if people want that, right? And again, that's if people want that. I think it's our belief that people should be able to use drugs if they want to, right? I don't think that, again, should not be controversial. Come on, baby. There we go. Here in the US, we officially have 2 supervised consumption sites, both in New York City, both relatively recently open. And in the short time that they've been open, there have been, they're going on 4,000 participants served and almost 1,000 overdose interventions. As I mentioned, though, turns out this progress is tenuous. New York Times just reported that the federal prosecutor for the Southern District of New York is threatening legal action to shut them down. So we need to build consensus. We need our policymakers to support this. That was the criticism, was that they are operating without any formal legal mechanisms. And so we're here to say we need this in Minnesota. We need to build support for this. I press the button and then it buzzes. There we go. Come on, baby. Okay. Cool. Is it you next? Oh, okay. Another common sense, scientifically supported intervention is access to anti-relapse medications, medications that treat substance use disorders. We have a pretty solid pharmacotherapy for alcohol use disorders and, of course, opioid use disorders, things like buprenorphine, aka Suboxone, things like methadone, and we are also seeing there's some support for high-dose prescription stimulants for the treatment of stimulant use disorder, like super high-dose Adderall and amphetamines. Can you do it?
Can I do it? Sure. I am an eternal optimist. I also tend to get my marching orders from the universe. So I'm excited about what's happening. I'm disheartened to hear about what's happening in Manhattan and pressure from the federal government regarding legality of their operations there at On Point. But there are a lot of things converging, and I had a really cool slide that showed convergence, but you can imagine it, right? Lots of colors and lots of swirls. So what is converging? Well, we legalized cannabis here in Minnesota, which is great. Our mayor, who was here yesterday, did, I think, a wonderful job, and for the advocacy of a lot of the leaders that are here in the room, deprioritized, entheogens and not enforcing fungi, and really setting the stage for access to life-changing, transforming medicine. We have the Psychedelic Task Force, of which Jessica and myself have been appointed, and I think that we're going to be able to make some pretty powerful recommendations to the legislature about why it's important that people have access, and we're not just talking access in a clinical setting, but also access in community and the need for really upholding sacred tradition and culture as we use these very, very valuable plants. What else is converging? The Minnesota Overdose Awareness Organization. Sorry, I'm talking too close, I guess. We had a benefactor who purchased a building for us just blocks from here on the corner of 39th and Fremont. And hello? Yeah. And it's a beautiful little brick building, and we're in the process of demoing it. It has a really good vibe. It's got a good soul. And I think some interesting things are going to happen there. We are hoping to, create a recovery center there that offers a variety of services to the community based on what the community tells us they need. And so this location holds promise for, I think, really innovative and effective services for folks. Our governor did pass a provision in May for the development of safe recovery sites, they're calling them. And the provision is allocating, I think, $14 million for these sites. And of the services that are included in these safe recovery sites, safe injection is one of them, access to hygiene, access to resources, to health and wellness services. So the center that we're looking at opening on 39th in Fremont, we're, like I said, we're just doing the demo now, but we're moving toward the build out, and it's going to have laundry and showers and sinks and a little kitchenette and lots of those big beanbag chairs. And we've got a partnership with the Coot Clinic Mobile Health Initiative, and this is a medical provider and a nurse and a nurse practitioner and a nurse that do mobile health care in the community that are offering to be on site. We've been coordinating with the 3300 Fremont Federal Qualified Clinic here, also in the community, and doing some work with their community health workers about ways that we can really be innovative and share our resources. They do have, I think, 5 Suboxone providers on site. And so, we're building our relationships in the neighborhood as well. So I'm excited about all those things that are coming together. And I know that, the numbers are alarming for sure. And the news that you just shared today about the feds are of concern. But I do believe it's also a time of hope. I have had so many people share with me in my 40 years of doing this work, but more so, obviously, lately, how when they have access to important medicine, that their lives transform and that people heal, and however that path looks for them. And so there is a lot of hope and there is a lot of healing. And so I choose hope. So thank you.
We budgeted some time for questions. If anybody has any questions, I'd be happy to take them. Cool. Preaching to the choir. Nice. Go ahead. Ooh, what do we need to do to get safe supply? Good question. I mean, I guess I'd kick it back to our, psychiatrist friends. But I guess in my experience working with clinicians and folks who are doing the prescribing, there is a lot of fear of punishment by the medical boards, right? A lot of fear of, being stripped of your license for stepping a little bit outside the lines, right? And so the high dose Adderall that we heard about as being used to treat methamphetamine use disorder, that was done under the auspices of a clinical study, a clinical trial. And so they were able to prescribe those doses without fear. So I guess in my limited view, getting the medical boards to approve of something like that, or to make sure that the folks who are putting themselves on the line have assurances that they can do so without fear. And that's what we saw in our neighbors up north. And again, those participant responses speak for themselves. I guess one cool innovation in that realm is that the American Society of Addiction Medicine, this kind of professional group that certifies clinicians, they are coming out in favor of certain forms of agonist therapies. And so I think maybe we could ride that wave a little bit, because that they're typically a little bit of a not necessarily the most liberal group, right? And if they're coming out on board, that's a good sign. So I think we're moving in the right direction, but we still got a ways to go. Yeah, great question. And if anybody else has take on that, be happy to hear you. Any other questions?
I do think it's curious, though, that we've kind of figured it out with opioids. I mean, granted, it's still in a medical system, but for some reason, like, okay, agonist treatment is okay with opioids, but not with stimulants. Like, why is that? Or you can't use a benzo to treat alcohol use disorder, and but so I think we've come a long way, and I really respect again the prescribers that are willing to go out there on the skinny branches and at least start recognizing how agonist treatment helps people engage, helps them, feel well enough to consider some potential different options, and so and that perhaps their system will require long-term ongoing use of agonist treatments, and so I feel like we're very slowly kind of making our way there. But again, if there's anyone else in the audience that would like to speak to Safe Supply, any other questions as well? Yes.
Well, okay, so do you want to repeat the question? Yeah.
I was just wondering what type of regulation are the courts saying that the safe consumption sites don't have to continue to operate? If they're run by medical professionals, and if you're going to be doing it in a park, what is the difference between doing it somewhere that has people on site who can ensure that it's done safely?
Right. So my understanding of the one New York Times article that came out this week was that it's not enshrined by state or federal law And so essentially the federal prosecutor, in a certain sense, was calling on legislators to pass a law that allows for this, because right now there isn't a state law, or certainly not a federal law, under which they're operating. So, so essentially he was calling on legislators to do that. Because I think the statute that was referenced was what was it? Oh gosh. There's like a crack house legislation from at the federal level, and so they were going to punish it under that law. Knowingly allowing people to use drugs in your building can be prosecuted under federal law. That's my understanding.
And you're gonna have like a political pushback with this. The DOJ has been involved, and the DEA, and of course it's going to be bantered back and forth. It's a states' rights versus federal issue.
Yeah.
And it will be curious because we do have a provision that was passed by the governor in May that does give us some state laws. So what I do know after speaking with representatives at the state level is that, can we forward this? Whoever's got any forwarding capacity, just to at least oh yeah, back one. Sorry. There you go. So that's the building that we purchased over on Fremont. And that's the other Minnesota Overdose Awareness Organization. And the little flyers that you all have, I'm sorry, a little tangential, but we're having a conference. It's free. There's a $50 donation if you want to, but it's free. It's going to be on National Overdose Awareness Day, which is August 31st. It'll be at St. Mary's, and we got really a bang-up cast of people there today to present that day. So if you can join us, we'd love to have you. And then that evening, we will be having our annual vigil. So anyway, that's going to be our resource center.
Can we do one more question?
Okay. I'm sorry, what?
One more question?
Okay.
If we have time.
Yep. You can advance the slide, please. Thank you.
Yeah, I just wanted to ask about the psychedelics advisory panel that you mentioned you were a part of, and if you could describe a little bit more about it, as well as sort of timelines and hypothetical bills you might try and legislate for, promote, I guess.
All I know is that we haven't been convened. I think someone shared at a big psych meeting last week that they still have a vacant position, an unfilled position, I think representing Native Dakota position, and so I think we're kind of stalled out until that position gets filled. My understanding is we have 2 years. Our first report is due to the legislature, I think, in February, just to make recommendations. Jessica is also appointed, and I know, Jessica, if you want to chime in, that would be helpful.
Yeah, so I think we're going to have our first meeting sometime in the fall, is what I've heard. And it doesn't seem like there's a whole lot known around how it's actually going to be implemented. We're supposed to meet once a month, review the literature, talk about the different facets of how psychedelics can be integrated into our medical system in the state, have some kind of preliminary report in February, and then by, I can't remember if it's February or June of 2025, then we should have like something more concrete. And the idea is like, how can we bake this into our current healthcare system? Can we get MNsure to cover it so it's not so expensive like it is in Oregon? Advocating for, community aspects and like decriminalizing these things, because legalizing them. Because one aspect is trying to inform the legislature on changing the Controlled Substances Act in Minnesota so we can legalize MDMA, psilocybin, and LSD. Those are the three they want to focus on. But legalization doesn't always fix the problem of criminalization, because they'll find out, law enforcement will find other ways to criminalize people for different things. We also need to do decriminalization at the statewide level of these things, plus legalization, so we can have the medical model and the community model. So we'll see how it goes, and I think all of us that are on the task force should really be listening to the community and what does the community want around this, so that we can inform the legislature on how to actually implement that. But it's kind of not really gotten anywhere at this point, so hopefully we'll see some progress in the fall.
We do have time for one more question, so I'm going to hand it over.
I just had a little follow-up, if that was okay. I agree, safe supply is for sure the only logical option. To me, it seems like there's a lot of resistance to it, and so I'm wondering how you all feel about, like, as an intermediate step, authorizing like community drug checking. And fentanyl test strips are great, and everybody should have fentanyl test strips. But I'm talking about like quantitative drug testing, where people can know exactly what and how much it is that they're taking as a stepping stone to safe supply.
100%, absolutely. Because right now that is, it's prohibited and also prohibitively expensive, right? And there's actually a model for that, the Drug User Liberation Front, DULF, up in Canada, they're a drug user collective that gets their hands on pure drugs and distributes them to the community. And so I think there is there's opportunities for communities to get involved 100%. And that'd be a great intermediary step to have free and reliable access to drug checking, instantly. I mean, that'd be phenomenal and something that we could totally advocate for in the short run, 100%.
I just want to echo what Jessica talked about regarding access, because what's going on in Oregon, yeah, it's for people that have a lot of money and it's not accessible through healthcare. And so part of what the mission at Expanse has been is to be able to, contract with the health insurance companies, which we do have Medicaid pay for our services, and continue to push the health plans to, understand the benefits and start paying for it. So I'm, committed to, as we medicalize, we want to do it in ways that, again, are effective, are, person-centered, and are paid for by the healthcare system. But that's just one path. Again, we need to make sure that with again, moving toward hopefully decriminalization and community access. So it's all of that is important.
There's the theme of this medicalization seems to be like gatekeeping, and how can we open the gates and ensure widespread access for folks who need it when they need it, and to have it delivered with high quality. So
We also need the fentanyl test strips. I was on the train, the blue line from the airport to home, and ran across 30 fentanyl pills just sitting there on the seat. I took them home, and my building actually has access to these fentanyl test strips, and I tested them, and they were positive for fentanyl. So we need to get these test strips out there into GRH housing, health centers, and anywhere the community might need them.
thank you so much. Thanks to Big Psych. Thanks for having us.
Yeah, sure.